Welcome to the Joint Replacement Club at Northeast Baptist Hospital. My name is Melissa Johnson and I am the orthopedic liaison here at Northeast Baptist. We are proud to say that we have been a center of excellence for total knee and total hip replacement since 2010. I will be leading your Joint Club class today. The purpose of this class is to teach you a little bit about what you can do before to prepare for surgery, about your surgical experience, and what you can expect during your recovery here in the hospital. If you have any questions, we'll have time after class to answer any questions you may have. If you're viewing this DVD at home, we will have phone numbers available for you to call if you have any questions. We'd be happy to answer any questions you may have. First, let's talk about some things you can start doing now to prepare yourself for surgery. You should have received a guidebook from your surgeon's office. There is a knee and a hip guidebook. If you have not received one of these, please contact your surgeon's office to get one. There's a lot of good information in the guidebook, so please read this guidebook front to back before your surgery. It will probably answer a lot of questions that you have. Our goal is for everyone to transition home safely, so it is very important that you create a space in your home that will allow you to do so. You will be using a walker for 6 weeks, so one of the things we recommend is that you create a safe path through your home that the walker will fit through. We also want you to pick up any throw rugs that are on the ground or any extension cords or cords that are along the path that you will be walking. These are trip hazards and we don't want you to fall, so please make your space safe. You will find a picture in your guidebook that has a bunch of reminders of things that you can do to make your place safe. We also recommend that if you have a chair or a space on your couch that you like to sit that's low, that you put some firm pillows on the chair or couch to help elevate where you're sitting. It is much easier for you after surgery to get up from a higher space than a lower space. It is also recommended that for footwear that you use rubber-soled shoes or non-skid socks. We really don't want you wearing flip-flops or any kind of sandals with no backs. These are also trip hazards. It's easier to trip in this kind of shoe, so please prepare yourself for that. If you take a look on the next page, after the living room safety picture, you will find a checklist of things that you can start doing to prepare for your surgery. It'll have the safety items listed on there, but also things that you might not think about. Make sure that you have enough groceries. If you're going to be home alone, prepare some frozen meals that'll be easy to eat when you're home. Also, arrange for your mail, someone to pick up for your mail for you. This is just a good little checklist of things you might not think about to do before surgery. 5 days before surgery, you need to stop shaving on your operative side. It is very important because we don't want any microscopic or tiny nicks or cuts in the leg that could present opportunity for infection. So please, 5 days before surgery, no shaving on that side. They will use special clippers to clip the hair in the operating room. There are a few things that we recommend that you bring with you to the hospital. First, we recommend that you bring 3 loose changes of clothing. Anything that is comfortable for you that you like to lounge around in the house. We don't recommend anything like pants that's tight and restrictive. It could be athletic wear if that's what you like to wear. Pajamas is perfect as well. Ladies, sometimes we like to wear dresses to be comfortable, but we will be in a group setting during physical therapy, so remember below the knees would probably be best. We also recommend that if you have obstructive sleep apnea that you bring your CPAP machine with you. Please bring that. Toiletries, we have all the basic toiletries here in the hospital, but if you would like to bring your own, you're more than welcome to. We also recommend that if you use eye drops, please bring your eye drops with you. All the rest of your medications can be left at home. We have most of them here in the hospital. You are more than welcome to also bring your cell phone with you, but please leave everything like laptops and tablets, please leave those at home. We don't want any valuables here in the hospital. So the day before your surgery, you have been instructed to be NPO, or have nothing by mouth after midnight. That is very important, and that includes no candy or gum after midnight. Some of you have been instructed to take a medication in the morning. That's okay. Please take that medication. Just use a small sip of water to take that medication. Everyone should have received a bottle of soap from the pre-admission testing nurse. If you have not received the soap, please get in contact with us and we can get you one. This soap is very important. It helps prevent infection by washing away bacteria on your body. So the night before your surgery, take a shower as normal and then get a clean washcloth. We want you to use half the bottle of soap, lather it well in the washcloth, and use it from the chin down. Avoid your face and your private areas because the soap can be irritating. Make sure to really focus on the joint that you're having surgery on. Make sure to get behind the joint, on the sides of the joint very well. The morning of your surgery, repeat the same process. Get a clean washcloth, the second half the bottle of the soap, lather it up, chin down, really focus on that joint again. Let's talk a little bit about the check-in process on the day of surgery. We want you to park in the north parking lot. And how you get there is you're going to go all the way to the end of Village Drive. At the end of Village Drive, it dead ends into a brick wall. Turn left into the parking lot. If you need to be dropped off at the front door, there is a roundabout for you to be dropped off. You will see on the doors, it'll say North Entrance, and there will be yellow writing on it. It is also sometimes called the yellow entrance. So park in the parking lot there. You will come through the doors. You will see a desk. Typically there's someone at the desk that can guide you, but if for some reason there happens to not be someone, it's very simple. Just go behind the desk. There's a set of elevators. Take them to the second floor and it opens right up to where you need to be. You will actually be checking in at outpatient surgery. We know it's not an outpatient surgery, that's just where everyone checks in. Once you check in at the front desk, you will be taken to a pre-op room. In the pre-op room, you will have a nurse who will start your IV and start some IV fluids. You will get to meet with an anesthesiologist. Your anesthesiologist will go over their plan for you for your surgery. They will also ask you a million questions that you've already been asked before. What are your allergies? Have you had surgery before? You will also have another chance to see your surgeon. In this pre-op area is the time to ask any questions that you may have left about your surgery. You will also get a dose of antibiotics. These antibiotics are prophylactic antibiotics, which means they're to prevent infection. Everyone will receive some antibiotics before surgery and also some antibiotics after surgery. When it is time for your surgery to start, you will be taken to the operating room. Your family will be sent to the surgical waiting room. One thing that is very important, these surgeries typically only last from 45 to 90 minutes average. So we ask that the family wait in the waiting room. If you would like to get a bite to eat or something to drink, please do it after the surgeon comes and talks to you. Often the surgery goes quicker than the family thinks, and the surgeon comes out and there's no one to talk to. We want to make sure everyone has a chance to talk to the surgeon to get an update on their loved one. After your surgery is done, you will be taken to the PACU, or post-anesthesia care unit, also known as a recovery room. You will typically be here for about an hour to 2 hours. They're just making sure that you're waking up great from anesthesia, that your vital signs look good. If you have any pain or nausea, they will give you pain or nausea medicine to help keep you comfortable. When you're ready, you will transition down onto the Joint Club floor. We're the only inpatient unit located on the first floor. We consist of 26 rooms. All of our rooms are private. You don't have to worry about having any roommates here on Joint Club. But if you would like, we would gladly allow someone to stay the night with you. After your surgery, just let us know and we can help set up sleeping arrangements for them in your room. The number one priority on the floor is your safety. It is very important to us that you are safe and you do not fall after your surgery. You will hear us talk over and over and over about fall precautions. Our main fall precaution here on the Joint Club is if you need to get out of bed or even sit on the edge of bed, you must have a staff member. So please, please call us anytime you want to get up. If you need to use the restroom, if you'd like to brush your teeth, it is very important that you call us. Please call, don't fall. It is very normal when you first get to the floor for one of your legs or even both of your legs to feel very numb and heavy. You might not be able to move them or wiggle your toes. Don't be scared. That's very normal. Your legs go through a transition period. They start numb and heavy and they kind of transition to a tingly sensation, almost like when your foot is asleep, and then it'll go to a normal sensation. Everyone wants to know when your foot wakes up. But of course, I don't have the answer to that. It is very specific to each person. So typically, everyone's foot is awake by the morning. We try to get everyone up on the day of surgery. It really depends on how you're feeling, if your vital signs are looking good, and what time you come in the day. If you do not see physical therapy the day of surgery, you will be the first that they see in the morning, and it is early in the morning, usually around 7 in the morning. So everyone gets physical therapy very soon after surgery. Pain management is very important to us here on the floor. There are quite a few things that we use for pain management. They are very different for every person. So let's kind of talk about the different things that we use. One of the first things we use for some people is a PCA. The PCA hooks to the IV pump. It is a machine that has pain medicine inside of it, and how it works is you are able to push the button, and whenever the button is pushed, it delivers medication to you on a specific time frame. There's a very important safety aspect about the PCA that we need to discuss. No one is allowed to push the button but yourself. I'm not even allowed to push the button on the PCA. If we find out that someone else has been pushing the button, unfortunately we have to take it away, and this is for your safety. So remember, if you have a PCA, only you are allowed to push that button. If you do not have a PCA, you will still have the same medication available for you, the same IV pain medicine. You just will need to ask your nurse for it. It is very important throughout your stay that you keep an open communication with your nurse about your pain regimen. If something isn't working for you or it's making you not feel good, make sure to talk to your nurse with it. We have a whole slew of things that we can use for you, and we want to make sure you're comfortable. Typically on the first day, we use a lot of IV pain medication to help control your pain. And then the second day and thereon, we use a lot more oral pain medicine. We want to make sure that we can find something that works for you and will work for you when you go home. Some of you may have a pain ball. If you're going to get a pain ball, you will find out before your surgery from your surgeon or your anesthesiologist. This is a little catheter that will go on the nerve of your surgical leg, and it just drips small amounts of pain medicine onto that nerve to help dull the pain sensation. If you have a pain ball, you may have a longer period of time where your leg feels numb and heavy, where you can't quite wiggle your toes yet. That is normal. Don't worry about that. When we pull out that pain ball catheter, it'll wake up. A lot of people are interested to know, when can they eat since they've been so long without eating something? When you get to the floor, we will have ice chips and water here for you, so you'll be able to drink something right away. As long as you're not having any nausea after 30 or 45 minutes, you're more than welcome to have something to eat. Everything here is on room service. You will have a menu, and on the menu there's a phone number where you can go ahead and call and order what you want to eat. I have a recommendation though from experience. On the first day, please don't order the meatloaf or pot roast. It may sound like a great idea, but after you eat that heavy meal, you're not going to feel so great. So if you want to order something heavy, please wait till the day after your surgery. On the day of your surgery, keep it light. Soup, salad, sandwich, that'll be great for you. After having this surgery, you are at risk for developing a blood clot. So there are quite a few things that we do to help lower that risk and keep you blood clot free. First, we like to use these beautiful white hose right here. These are called TED hose. You will wear these for 6 weeks, 24 hours a day for 6 weeks. These are very, very important. You will be allowed to take these hose off for 30 minutes a day. They're kind of like pantyhose. They're a little bit thicker and a little bit tighter. You will wear these hose on both of your legs, and they come up to the thigh. We will give you an extra pair. Make sure you're giving your extra pair before you leave. To wash them, you hand wash, air dry them. A little trick we like to let everyone know about putting your TED hose on. They're kind of hard to get over your feet. So they come in a little plastic bag, or you could use something like a bread bag or a grocery bag. Slip that over your foot, and then you would just take the TED hose and just kind of scrunch them up like you would do a normal pair of pantyhose and slide them over that bag over your foot. Getting it over your foot is the most frustrating part because they're so tight. So once you slide it over, there's a little hole in the bottom where you can just pull the bag right out. That will save you a lot of time and frustration for putting these on. Remember, TED hose, 6 weeks, very, very important. When you're in the hospital, you will also use something called sequential compression devices. You will have one of these little cuffs on both of your calves, and they hook to a machine that's on the end of the bed. You will only use these while you're in the hospital and while you're in bed. Most of the day after surgery, you will be spending in the chair, so you won't have to wear these, but you will wear them while you're in bed. And how they work is one will inflate and deflate, and then the other will inflate and deflate. They take turns, and it's just to help keep that circulation going. Both the TED hose and the sequential compression devices just make sure that blood isn't pooling in your legs. It's circulating nice and well so that no blood clots can form. A third thing we use to help prevent blood clots is a medication. Everyone will be on some sort of medication here in the hospital and for a time period after to help prevent blood clots. After your surgery, your nurse will discuss with you what medication you'll be on and will give you instructions on what to do when you go home. In your hospital room, you will see boards in your room that are communication boards. They're for communication between nurses and you, physical therapy and you, and also between us staff members and your surgeon. So let's look at our main communication board. Here on the main communication board, you will see some of the basics of your stay. It will have the date, your room number, what your room phone number is. You'll see your physician. We will put your surgeon and your medical doctor on here so you know their names, who your nurse is, your nursing assistant. We like to put the day of surgery on here. We'll put what your procedure type was. This section right here is about pain management. We like to establish a pain goal. Here is a FACES scale. We will ask you a lot of times what you rank your pain at, and this is a scale that we use between 1 and 10. We like to put the name of the medications that you are on underneath. Right here also we'll let you know when you can receive your pain medication next. So you will have a time right here where you can call your nurse and ask. This section right here is completed by physical therapy. They like to rate how far you walked. Where it says bathroom needs, that's just communication with us about if you're allowed to walk to the bathroom or not, if it's safe enough. They'll let you know what group therapy time you'll be going to. Sometimes we happen to have 2. If we're having 2, they'll put the different times here. And equipment. This is just to let us know what equipment you have or that you need. Right here, discharge planning. Are you planning to go with home health or facility? We like to put discharge planning information here. And diet. Typically you're either on a regular diet or diabetic diet. If you have any other diet modifications, let us know. We'll put them on the board. Also, if your doctor changes your diet for any reason, this is how we communicate with you about what your diet is. This is your medication side effect board. You will see on here medications that you have been prescribed. Your nurse will review this with you as she gives you medications. On this side, you will see the trade name of the drug and the generic name of the drug. And the next column is the purpose. Why are we giving you this medication? And in the third column, you see side effects. It is very important that you always know the side effects of your medications. So you'll see common side effects on the right-hand side. You see this strip is in yellow. All the pain medications are in yellow. We will tailor this and make it specific to the medications that you are on. If you have any questions about any medications anytime you're in the hospital, please ask your nurse. The third board you will find in your room is your goal board. There are different sections of the goal board: diet, activity, treatment, pain management, and discharge planning and instruction. We just want to see you progress through these goals. And once you finally meet all the goals that we have set for you, then it's time for discharge. We will talk more about this board when you're in the hospital. So let's talk a little bit about your typical daily routine. So usually everyone wakes up very early. The surgeon's around early in the morning usually, and they're usually the ones to help wake you up. Physical therapy will come into your room. They will get you into the chair before breakfast, so around 7:30 in the morning. Everyone eats breakfast in the chair. Let's meet physical therapy and occupational therapy to help talk about the rest of your day with you.
Hi, I'm Alex. I'm with the physical therapy team. I'm going to be talking about some precautions to be aware of and then also some equipment that you're going to be going home with while you're here in the hospital. The first I'm going to talk about is if you've had a knee replacement. The CPM machine will be something that you wear for a total of 6 hours a day. It'll help promote range of motion and pain management. The next we're going to talk about is the extension boot. The extension boot must be worn at night for a minimum of 6 hours depending on who your surgeon is. If you are having a hip replacement, there are 3 main precautions that you'll follow throughout your period of recovery. The first is no bending past 90 degrees, which means no bending and standing to pick anything up off the floor, and no sitting with your knees above your hips. As you can see here, this chair is too low, so his knees are above his hips. You will be receiving what's called a hip pillow from us here at the Joint Club. This pillow is to help you maintain your hip precautions. So you'll put it into chairs that are lower in order to help keep your knees below your hips so that way you don't break that 90-degree rule. The next is no crossing your legs. No crossing your legs, and then also no turning that surgical foot inward, so no pigeon-toed. It is very important that you maintain these hip precautions throughout your recovery in order to avoid any complications.
Hi, my name is Taylor and I'm with the occupational therapy team here at the Joint Club. I'm here to go over a few tips and tricks to help you maintain a safe and independent lifestyle after your discharge. The first thing I want to go over here is the 5-item hip kit. This hip kit is optional for you to purchase to make sure you're staying safe and independent while dressing and also bathing. The first item in the hip kit is going to be the reacher. It is very, very important to have one of these with you at all times so that if ever you drop something while standing or sitting, you do not break that 90-degree precaution and you can reach with this long arm reacher here. This is a sock aid to help you put your socks on. This is a dressing stick, can be used for many things, whatever you may choose. The long-handled shoe horn, and then also the long-handled sponge. These all work as like your long arm to prevent you from bending past those 90-degree precautions while you're standing or sitting. Okay. The next thing I want to go over is after you discharge to the hotel, we do recommend that you have an elevated toilet seat. The hotel should be providing these for you, and if you do not have one when you get to the hotel, just make sure to call down to the lobby and they will provide you with one, and they should be able to apply it onto your toilet when you get to the hotel. One of the things that's important to go over is making sure to use non-slip socks or shoes that have a back. It's important to be wearing non-slip socks or shoes once you discharge from the hospital to maintain that safe ambulation when you get home. So you'll be provided with 2 pairs of the non-slip socks to be worn over the TED hose that we went over with you earlier in the video to prevent from slipping when you're walking with the walker and getting around at home. So if you do not choose to wear the non-slip socks, making sure to be wearing non-slip shoes that have a back. So no Crocs, no flip-flops, or anything of that nature. You must use the walker a minimum of 6 weeks. The only person who can clear you from not using the walker after surgery is going to be your orthopedic surgeon. While you're using the walker, it's important to make sure you have both hands on the walker at all times for safety. When you get to the sink and you're brushing your teeth, you want to have one hand on the sink while you're brushing your teeth instead of having one hand on the walker. If you have one hand on the walker, it could possibly tip and you could go with it. Same goes for when you're walking and you're holding something. You want to make sure you have some kind of basket or a bag you can place on the walker to be holding the items for you. So when you're walking, you're not walking with one hand and have the tendency to trip. Both hands on the walker at all times.
Hi, I'm Logan with Physical Therapy. Once you get to the hotel room, there are a few other key points of information we'd like to talk about. The first will be your dressings. Type of dressings include a Pico wound vac. This will be on your incision with a little box. You will have this when you leave the hospital, and it will be taken from you whenever you follow up with your surgeon before you go home. The second type is just a dry dressing. The dry dressing you will have while you're here, you'll have when you leave, and we'll teach you how to apply and reapply it once you get to the hotel. We've talked about proper walker use, but once you get to the hotel room, to avoid overexerting yourself on those long stretches of hallways, the hotel should provide a wheelchair for you. If you do not have a wheelchair in your room or available to you, go ahead and ask the front desk and they should get one to you right away.
Hi, my name is Anthony. I'll be visiting with you the day after surgery to talk about outpatient physical therapy. To help with getting this set up, please have a physical therapy clinic chosen before you arrive. If you're unsure of a clinic, the best way to locate one is to call your insurance and ask them to provide you with the few clinics that are in your network. The day that I visit with you, I will be collecting the name and number of the clinic and also a copy of your insurance card to submit with the referral to the clinic. The day before your surgery, you will check in at the main entrance of the hospital. After you visit with a pre-admission testing nurse, you will walk over to your surgeon's office for your pre-op appointment.
This concludes the educational portion of our Joint Club video. We look forward to having you here at Northeast Baptist and helping you on your road to recovery. If you have any questions, please contact the Joint Club.